Hello, beautiful souls. I'm Dr. Anna Schneider, and if you're watching this, chances are you're either pregnant, know someone who is, or you're just curious about why that pesky back pain seems to tag along with the miracle of growing a tiny human. Well, you're in the right place. For over 15 years, I've helped women just like you conquer back pain, reclaim their strength, and feel proud of the incredible power their bodies hold, especially during pregnancy. Today, we're diving deep into what causes back pain when you're expecting, why it's not just something you have to live with, and how you can take charge of your body like the warrior you are. Pregnancy is a wild, beautiful ride, but let's be real, it's not always comfortable. That ache in your lower back? It's not a badge of defeat, it's a signal from your body, begging for a little love and attention. So, grab a comfy seat, or a pillow if you're already feeling that twinge, and let's get started. Oh, and stick around to the end because I've got some practical tips that'll have you standing taller and feeling stronger in no time. Hit that like button if you're ready to take control, and let me know in the comments, where are you watching from today? I'd love to connect with you, whether you're in New York, Tokyo, or a little town I've never heard of. Let's break it down like friends over coffee. As a doctor, I've seen countless women come into my office saying, "Dr. Anna, why does my back feel like it's staging a rebellion?" The truth is, your body is doing something extraordinary, it's building life. But that comes with some serious changes, and your spine? It's taking on a Herculean task. First up, hormonal shifts. When you're pregnant, your body pumps out a hormone called relaxin. Sounds relaxing, right? Well, it's a bit of a double-edged sword. Relaxin softens your ligaments, those tough bands holding your joints together, to prep your pelvis for delivery. Amazing, yes. But here's the catch, it also loosens the joints in your spine and hips, making them less stable. Imagine your spine as a stack of blocks, suddenly, those blocks aren't glued as tightly, and they start wobbling under pressure. Next, there's the weight gain. You're growing a baby, a placenta, extra blood, and fluids, that's anywhere from 25 to 35 pounds for most women. Your lower back, especially, feels that load because it's working overtime to balance this new weight out front. Think of it like carrying a bowling ball around all day, your back's like, "Hey, give me a break." And then there's posture. Oh, posture, you sneaky little culprit. As your belly grows, your center of gravity shifts forward. To avoid toppling over, you might naturally lean back a bit, putting extra strain on your lower spine. I see this all the time, women unconsciously arching their backs, and suddenly, those muscles are screaming for mercy. Here's a question for you, have you noticed your posture changing lately? Maybe you're slumping more or catching yourself leaning back? Drop a yes or no in the comments, I'm curious. Now, let's not forget muscle separation. Your abdominal muscles, your core, are stretching to make room for your little one. Sometimes, they even split a bit down the middle, a condition called diastasis recti. When your core weakens, your back picks up the slack, and that's a recipe for discomfort. Pregnancy isn't a disease, it's a superpower. But these changes? They're real, and they're why so many of you feel that ache. The good news? You're not powerless. You're not broken. You're adapting, and with a little know-how, you can fight back. Okay, let's get a tiny bit nerdy, don't worry, I'll keep it simple. Picture your spine as this elegant, S-shaped curve. It's designed to absorb shock and keep you upright. But during pregnancy, that curve gets exaggerated. Your lower back, called the lumbar spine, starts to sway inward more, a fancy term we call lordosis. That's your body's way of balancing your growing belly. Meanwhile, your pelvis tilts forward, and those sacroiliac joints, the ones connecting your spine to your hips, get a little cranky under the pressure. Add in tight hip flexors or weak glutes from sitting too much, and you've got a perfect storm brewing in your back. I've spent years studying this, and here's what I tell every patient, your body isn't failing you, it's talking to you. That pain? It's a signal to move smarter, strengthen what's weak, and stretch what's tight. You're not a victim of pregnancy, you're a champion navigating it. How does that shift in perspective feel? Let me know in the comments. Does thinking of pain as a signal rather than a punishment resonate with you? Now, here's where the magic happens, taking control. You don't have to just grit your teeth and wait for delivery day. As your doctor and your cheerleader, I'm giving you tools to feel better today. Let's talk solutions, safe, simple, and pregnancy approved. First, move with purpose. Sitting all day is your back's worst enemy. Try this: stand up every 30 minutes, roll your shoulders back, and do a gentle pelvic tilt. Tuck your tailbone under like you're smoothing out that lower back curve. It's like a mini massage for your spine. I've had patients tell me this alone cuts their pain in half. Second, strengthen your core, safely. No crunches, please, those can strain things further. Instead, try a seated belly breath. Sit tall, inhale deeply, and as you exhale, gently draw your belly button towards your spine. It's subtle, but it wakes up those deep core muscles that support your back. Do 10 reps, twice a day. You've got this. Third, stretch it out. Tight hips and hamstrings love to pull on your lower back. Here's my favorite, the cat-cow stretch. Get on all fours, hands under shoulders, knees under hips. Inhale, arch your back and look up. Exhale, round your spine and tuck your chin. Flow through that 5 times. It's like giving your spine a big, loving hug. And don't skip this, support your body. A maternity belt can take some pressure off your back, especially in the 3rd trimester. Pair it with comfy shoes, no heels. Ladies, your spine will thank you. Here's a fun one for you. What's your go-to way to relax when your back's acting up? A warm bath? A little stretch? Share it below. I love hearing what works for you. Let's talk heart to heart for a sec. Pregnancy can feel overwhelming, physically, emotionally, all of it. I've been there with patients who felt defeated by back pain, like it stole their joy. But here's what I know after years in medicine: you are stronger than you realize. This pain? It's temporary. Your resilience? That's forever. When your back hurts, it's easy to think, I can't do this. But flip that script, I'm doing this, and I'm doing it well. Celebrate the small wins, standing a little longer, stretching without wincing. You're not just surviving pregnancy, you're mastering it. What's one thing you're proud of your body for doing lately? Maybe it's carrying your baby, or maybe it's just getting out of bed on a tough day. Drop it in the comments, I'm here to cheer you on. There you have it, my friends, why back pain shows up during pregnancy and how you can kick it to the curb. You're not just a passenger on this journey, you're the driver. With a little movement, some smart support, and a whole lot of self-love, you can feel strong, proud, and in control. If this resonated with you, smash that like button, it tells me you want more of this. Subscribe if you haven't already. I'm here every week with tips to help you thrive, not just survive. And let's chat, where are you watching from? What's your biggest back pain struggle right now? I read every comment, and I can't wait to hear from you, whether you're in London, Sydney, or a cozy village somewhere. Until next time, keep shining, keep moving, and remember, your body is a masterpiece, and you've got the power to keep it that way. See you soon.